Good afternoon, everyone. I'm Mandini Kapoor, Director of the University of Sydney Musculoskeletal Research Centre, and it is my pleasure this afternoon to welcome you to the Falls Prevention Alliance Australia update webinar, looking back on the first 6 months of the Alliance. I'd like to begin today by acknowledging the traditional custodians of the lands on which we all work and are meeting today, and pay my respects to elders past and present, and hope that we draw inspiration from their custodianship and sharing of knowledge through innumerable generations today. The format of today's webinar will be an initial overview of key activities to date from our launch back in November last year to our policy workshop, some activities that have taken place since then, as well as some awareness work that has been happening. And I have a number of our professors who've been leading this work who will be presenting on that today. We will next move to the next steps, including some community talks by volunteer health professionals talking about which direction we'll be taking from this point, including a panel discussion that will be facilitated by Professor Kathy Said and attended by a number of panelists over 25 minutes of this hour-long webinar, with then a closing at the end by Professor Frances Batchelor. So without further ado, I would like to hand over to my colleagues for the opening segment, which will be an overview of our key activities, including the timeline to date.
Thank you, Mandy. Thank you very much. So within our timeline, like the first thing that we really want to discuss is just making sure that everyone who is here and just really knows that we are, that we have been working very hard on raising awareness around the problem, and we've been giving talks and doing lots of different things, all the way from writing pieces to various magazines, as well as launching podcasts and so on, just to really make it very clear to everyone that falls is a big problem, that we have an aging population that is very costly to the society. But the most important thing that we have been making sure that everyone understands is that falls are preventable, that we don't need to think that they are part of aging, but that Australia needs a national action plan to make sure that we can help older Australians to prevent falls and to have a long and independent life. So a few months ago, 6 months ago, exactly to the day, actually, we launched the Alliance, and we brought together people from academia, but also government, health professionals, community organisations, and we were really kicked into gear by consumers. And our main consumers were Bob Barnes and son David Barnes, who have been helping and pushing us along with some very lovely, famous Australians. Michael Caton also needs to get a very important mention here, because he very much was a driving force as well behind making sure that the Alliance started and that our message got out there. The main thing that we really want to do is to advocate for policy change, and as I said, making sure that everyone knows we can do something about it, but that everyone has opportunities and has a structure, a strategy to work together across sectors. We have 3 asks of government, and the 3 asks are related to having a national media campaign, an action plan, and better funding. And yes, thanks, Lauren, for already progressing to the next slide. We have summarized this as a lovely video, which takes about 5 minutes. And without further ado, Lauren, please launch the video.
Rotarian from Lismore, up near the Queensland border, and I'm here to helped launch this event today. There's 4.5 million people aged 65 and over in Australia, and 1 in 3 of them were falling every year. That's 1 every 20 seconds.
You had no idea of the scale of the problem. That was the thing that hit me. When you think of 18 people dying a day, now start doing the sums on that, and that's bad.
Every day, around 400 older Australians are admitted to hospital because of a fall, and 17 lose their lives. That's more deaths than from road accidents, melanoma, drowning and suicide combined.
Hands up in the audience who's had a family member affected by a fall. Can we have a little show of hands? See, look at that.
It was a sunny spring morning, very much like today 6 years ago, and my lovely 84-year-old dad was at his home. He decided he'd carry 2 hanging baskets upstairs so that he could repot them. On the 4th step, he lost his balance and he fell backwards and he hit his head. The trauma caused a hemorrhage in his brain and he rapidly lost consciousness and he never woke up. I'm sorry, it's still hard to talk about. My dad became one of the 17 Australians who died on that day because of falls.
Yeah, well, I hit the floor very hard and my L2 vertebra was, in the words of the surgeon, pancaked. It's a great verb, isn't it? It's a very vivid verb. The darkest day of my life, I think, was being in emergency at Sydney Hospital on an Easter Saturday, just wondering what this diagnosis would mean.
We're actually going through that with my own family at the moment, and both of our parents in their early 80s have fallen just in the last 12 months and broken ribs and other things. And so, you know, the timely nature of this, not just for our own family, but I think for an ageing Australia, you know, is incredibly important.
You know, think of your networks, think of the people you know. There is an opportunity to use this as a starting point to build a movement around it. Government reacts to what people care about. And so I think there's onus on all of us, I think, to make sure that we are reaching out to different parts of the community and also into government.
We have decades of research showing what works, but what we don't yet have is a coordinated national response to make fall prevention accessible to all Australians, whether they live in our cities or our regions. And that's why we have formed the Fall Prevention Alliance of Australia, uniting researchers, health professionals, community organisations, consumers. You can see them on the screen here. And we are joined today by satellite venues from across the country in Melbourne, Canberra, Brisbane, Adelaide, Perth, Batemans Bay, Lismore and Newcastle.
A lot of people go to their doctor worried about falling or had a fall, and all doctors can prescribe under Medicare is medication. But where do they recommend people to go to get dietitian advice? Where do they get exercise advice or pain management advice? And there's nothing under Medicare that has a focus on fall prevention.
We need to keep people healthy in the home. So not only do we need to make sure we train our allied health professionals critically, physiotherapists, exercise physiologists, OT, to name a few, but interdisciplinary care, so working hand in hand with our primary care, general practitioners and community.
We need to be supporting community exercise. We need greater awareness across the life course. We need health professional training. We need access to services.
Well, I think it's important to keep fit enough and well enough to be able to do the ordinary things. Walk upstairs without pausing, walk downstairs without falling. And you can do that by doing more and more walking. I think that's the first thing. And balancing exercises, that's another very good thing. You know, weight training also.
This is it's an absolute no-brainer. Australia doesn't know what we know in this room now, so in the next 12 months we need to make every Australian as educated on this issue as we are here, and we certainly will.
This is the beginning of the Alliance's work to meet its mission of reducing the burden of falls in older Australians through a national action plan that incorporates a media campaign and funding for much needed services.
Together we stand as one national movement for change and to shift the conversation from falls as inevitable to falls as preventable. Because at its heart, this is about people. And this is about moments that matter. Dancing at your granddaughter's wedding, walking your dog, or setting off on that long-awaited trip.
Stand against falls. There you go. Thank you, everybody.
What a great day that was. It was really a wonderful event. And since then, in the past 6 months, we've gradually grown as an alliance. We have over 200 individuals and more than 60 organisations that are supporting us, which you can see on the next slide. So you can see from the slide that we showed on the Alliance video how much we have grown. And it is really wonderful to have all of your support and to see you all represented here at this webinar as well. So after this initial segment about the launch, I would like to now hand over to Peter McHugh, who will take us through the first thing that we did after that, which was our policy workshop.
Terrific. Thanks, Kim. And I have to agree, it was a fantastic launch and a terrific event. And I was there representing the Asia Pacific Society for Physical Activity. I'm part of the executive of ASPA and also the chair of the advocacy committee. And so my interest is in particular physical activity policy development, including falls prevention policy development. And along with the executive of the Falls Prevention Alliance, we thought we'd capitalise on the Australian and New Zealand Falls Prevention Conference that was hosted in Sydney in November to run a pre-conference workshop about how we could focus on falls prevention policy development in some way. And in particular, there's the specific objectives listed down there. Explore some key factors to advance the falls prevention agenda. We heard three things in the video there. One of them was the development of a national falls prevention action plan, but what is it exactly that we'd like contained within that action plan? And then also identify some priority actions and next steps. And so Lauren, if you could just progress to the next slide. And so we've really very clearly heard that we've got a clear problem. We've got rates that are increasing. We know that it's costing us a lot of money, that there's a clear solution, and yet we're not getting political action. And so, Lauren, if you can just go to the next slide. So I asked ChatGPT to generate an image of a politician who hears all the evidence, but only thinks about all the costs of implementing something in response to that evidence. And this is what emerged. Although it's a little stereotypical, it does reflect that just because we've got a problem, just because that problem's getting worse, and just because we've got a clear solution to prevent that problem, doesn't mean there's necessarily going to be action on that problem. Lauren, just the next slide. But there are ways and there are frameworks to help that process. And so one well-known framework that's been established for quite a while suggests that if we look at a problem, come up with some solutions, align with the politics of the day, then there might well be a policy window opened where we can get some action. So that's exactly what we did in the workshop. We divided up into those 4 groups, and we tried to identify 2 or 3 key actions within each of those streams to see if we could generate some action. And so the first of those groups was to describe a problem, or the purpose of the first one was to describe a problem in a way that attracts political attention. So how is it that we get politicians interested in this work that clearly is a priority for all of us, but is only one of many things that politicians are thinking about? Of all of the various policy streams, or of all the potential solutions, what are some solutions that might cut through to those politicians and generate some interest? And from a political stream, how can we generate some willingness to move on that, and then we might get some action? And so then just the next slide, Lauren. So what we thought we might do is that as the groups then divided up and selected what they felt were 2 or 3 key actions within each of those areas, we worked through those potential actions that the groups identified and then put it out to you and all of the participants today to then rate those various actions. So what I'm going to do now is just go through from the problem perspective and the potential solutions to those problems that the groups identified, and then we'll have a go at filling in a questionnaire or just to rate how important we think those different actions are. So within the problem action, for example, there were 3 things that were suggested. One was a falls prevention stakeholder mapping. And so from that stakeholder mapping, it's to identify who's got some interest, what's their potential influence and reach of their interest, then map some current falls prevention policies and programs. So there's obviously lots of great things that are going on right around the country in different levels of government, from the local, at the state level, and then also at the federal level. And then another potential activity would be to quantify the various policies and programs that are going on, so that we can go to politicians with evidence-informed data about which ones of these proposed problems are most cost-effective. From the policy perspective, you can see there's a couple. One was to develop a guide for government policymakers that contained the most latest evidence-informed what works, so that policymakers at a government level know what to do, informed by evidence. And then the final one there is to determine the recommended components. If we're really advocating for a national falls prevention action plan, what are the components of that action plan and what does it look like, so that we can present that to government? And so, Lauren, can we generate the questionnaire for everyone? Okay. So hopefully everyone can see those 5 different things are rated down down on the left-hand side here. And what we've got is rating them from high, medium to low in terms of what you think are their level of importance. So if you can just take a moment, hopefully you'll be able to fill in, and for each of those 5 actions, take a moment to decide if you think it's of high importance, medium importance, or low importance. And just while you're doing that, Lauren will be able to tabulate the results and we'll be able to see what everyone thinks. And I'll rely on you, Lauren, to let me know if most of them look like they've completed. Maybe if we just gave a little bit more time to fill in those. We're really interested, we're really keen to see what you think of those different actions that have been proposed, what you feel are most important and least important. And now Lauren can maybe show us the results. Okay, so of those 3 categories, low is orange, the dark blue is medium, and the light blue is high. So what we're basically saying, everything's important, and that's great to see that that the participants here of today are really rating that of all of them, can prepare a draft National Falls Prevention Plan and what are the components of that draft plan. But clearly we're rating all of them quite important. Perhaps of all of the 5, the first 2, there's the greatest variance in terms of how we're rating them. Lauren, if you can just move to the next. Yep, terrific. And so then the last one, in terms of political opportunities and policy windows, there were 2 of each: to establish key advocacy priorities and messages aligned to current political opportunities. The second one, for the political perspective, was to develop a resource for local advocates so that the local advocates can then implement those priority campaigns from a Windows perspective. So once all of those three align and we've got something, an opportunity, develop an advocacy plan that kind of aligns all of those different things that we've spoken about. And then the final one there is to identify some resources to try and translate all of this to action. So again, there's the 4 items. If you can just take a moment, rate them from high, medium to low, and we'll just pause for a moment while you do that. And just while you're considering it, we're also going to send out the questions afterwards so that you've got the, if for whatever reason you're not, if you in case you're frustrated because you can't, it's not working at the moment, we'll also send it afterwards. So you'll be able to do that. And then Lauren, if you can just show the results. And again, orange was low, dark blue was medium, light blue is high. And so we can see that there's a real focus there on developing an advocacy plan to prioritise and promote key activities. So thank you for providing that feedback. We'll incorporate that feedback into a final plan, and that final plan will be available on the website. So that's a wrap in terms of what we were to do at the policy workshop. We'll make those results available. We'll also distribute that survey for you if you weren't able to complete it. And now I'll pass over to Kathy, who's going to talk about the Alliance's pre-budget submission.
Fantastic. Thank you so much, Peter. And thanks, Lauren and Melody, for those polls. Super clear. So we've set up a bit of a structure in the Alliance where we've got some working groups. And so we've got a policy and advocacy working group. And so we've been meeting to try and actually work out how to take some action and to sort of prioritise things. And so that's, you know, that'll link really, really nicely with those poll results in terms of our next plans. But I'd first like to acknowledge the other members of the group. So Associate Professor Frances Batchelor, Dr. Marina Pinero, Roisin Sweeney, Peter McHugh, who you've just heard from, Kim Hunter, Dr. Isabel King, Dr. Rick Dawson, Hayley Kajelski, and Adelina Tabila. And this is really a sort of multidisciplinary group representing sort of different organisations and individuals. And so we worked out, and we previously didn't understand this, but there is actually a formal process for organisations to submit to the federal budget to sort of, you know, provide evidence and request things to be considered in the budget. We don't actually expect that to make a difference just yet, but because we do need to do additional advocacy and sort of individual approaches. But really with a lot of help from that whole group, but particularly Adelina Tabila, who actually has some experience as a policy maker, we were able to pull together sort of fairly quickly a submission, which really outlined a lot of the evidence that was in that that launch video and the whole sort of basis of the Alliance in terms of the size of the problem, the evidence for solutions, but the lack of actual action and investment. And so then we were able to sort of synthesize that into the 3 key asks, which was that we actually have a National Falls Prevention Action Plan, that there should be a national media and public engagement strategy, and then there should be funding mechanisms for falls prevention. And so they're actually publicly available, these pre-budget submissions. And we're also thinking that's a nice document that we can use in kind of further advocacy. So it just brings me to the other thing I wanted to say before I hand over to Professor Anne Tiedemann, is that we are working towards planning an event in Canberra. So some sort of an event at Parliament House, where we invite politicians to and other public servants to come and sort of hear about the basis of the alliance, the size of the problem, the evidence for action, but the lack of current action. And so if anyone has any particular ideas or contacts or would be able to help with that, then yeah, please do get in touch. So yeah, I'll hand over to Professor Anne Tiedemann to talk more about some of the other activities.
Thanks, Kathy. Okay, working now. So yeah, I've been tasked with giving an update on the awareness working group that I co-chair with David Barnes from Rotary. And I'd just first like to acknowledge the large willing group of members that we have on the working group. So we have Sian Brems, Jessica Ray, Yvonne Poon, Mark Jones, Rosie Gregory, Gohar Yazdabadi, Kim Van Schuten, Eva Schiffeldren, Natalie Tolhurst, Michelle Rosa, Adrian Prakash, Beverly Baker, Connor Tui, Eleanor Kennett-Smith and Hilary O'Connell. So a large group of really committed people helping to push things further with the awareness around fall prevention. So we're really aiming to increase awareness about the impact of falls in older age, but importantly to also talk about evidence-based strategies that can prevent falls. And we're aiming to target everyone really. So we're aiming to create awareness amongst the community, older people themselves, their friends and family, and also health professionals and policymakers. So we know that everyone has a part to play in taking action in this space. So we've been quite busy since the launch. In February, March and April, we've done many community talks, which were provided by several members of the Alliance. And you can see some of the photos of these events on the screen here. They've included in-person presentations invited by Rotary groups and local councils in several states, as well as online presentations for health professional groups such as the RACGP. And we were also invited to participate in some events in New South Wales for Seniors Week in March. And so these events really did provide a great opportunity to spread the word about falls and increase the profile of the Alliance, and also drive membership to the Alliance. If we go to the next slide, please, Lauren. So since the launch, we've also featured in a number of media pieces and have been interviewed for several podcasts. And we're happy to take any opportunity to spread the word about the Alliance and fall prevention more generally. We're also very active on social media. So we currently have over 800 followers across our social media platforms, which include LinkedIn, Instagram, and Facebook. We've developed a structured social media plan for the coming months. So please make sure that you follow our social media pages and tag us in any of the falls prevention activities or events that you are undertaking. Next slide. Another great achievement in the past 6 months has been the development of a suite of professional videos. So these videos again aim to raise awareness about the impact of falls on older people, but also the actions that we can take to prevent falls. And these feature some of the famous Australians that we've seen in that launch video. So these include people like Michael Caton, Bob Carr and Craig Foster. We've also developed some call to action videos that are more targeted towards government and highlight the huge financial and health system burden of falls. And so these videos have been shared on our social media pages and will continue to be shared in that format. And they're also available to access via the Alliance website. So once again, we urge you to share them widely so we can gain more support and action in this space. So we'll just play one of these videos now as an example of what we've put together. Thanks, Lauren.
I fell full length.
I got out of bed in a rush. I went to the bathroom, and on my return, I just hit the floor.
My mum fell over last week. I'm terrified of falling.
My father, Peter, died from a fall.
Most people think that older people falling over is normal.
It's not. It's preventable.
Every day, 400 older Australians are hospitalised and 16 people die from a fall.
Are we headed for a fall? Stay on your feet, Australia.
Once again, feel free to share, and that's all from me at the moment, and I'd like to hand over to Emma now to talk about community ambassadors.
Thank you so much, Anne. Thank you to all the panelists who've spoken before me and for everyone who's attending today. So it is my pleasure to talk about a special branch of community engagement, which we called Community Ambassadors of Falls Prevention Alliance Australia. So it is about championing volunteering of health professionals in this special cause. So we are trying to mobilize health professionals to donate their time, expertise and skills in delivering these valuable education sessions in different communities, different community groups. So we worked hard over the last few months, I guess, to develop some resources, and they include presentation materials, some handouts for audience members, and we're still working on refining them further and conducting a study and preparing another one to evaluate these properly so we can prepare them on further and future training on community ambassadors in our next phase. So why volunteering? Simply because it is very cost effective. As we've heard, we have many constraints, including funding or government policies, but Australia is a great volunteering nation, and volunteering is a huge source of capital. So we can harness that at least in these early phases of our existence. So it is definitely innovative and very much sustainable. And this means that we can recruit health professionals who are currently involved as health professionals as clinicians or academics, but also in their retirement stage when they can reap the health benefits of volunteering. So we all know that volunteering is excellent for physical health, social health, mental and cognitive health. It stimulates creativity, problem solving, networking. So for those health professionals who are facing their retirement phase, it can create new meaning both personally and professionally, and keep them engaged with their community. So our resources are developed, we're refining them further, and I've used them to present to several groups during the Senior Festival in the month of March and the Falls Awareness Month, in the month of April. There are a few of them coming up where we can use the feedback of people who are involved to gain more data when it comes to evaluation of this strategy, I guess. So our mission is to help Falls Prevention Australia foster collaboration and extend awareness and education. So why does this matter to involve health professionals? Because they are seen as trusted messengers that can help translate the evidence that we have into community action. So they're this important link. And falls programs are more likely to spread when clinicians are not mere advisors within the four walls of their clinics, but when they're embedded in the community and when they are the actual link between the policies and the services and community groups. So yeah, we'll be keeping, our focus on this and keep working further so we can actually use volunteering of health professionals to train general members of public to further spread the word and the awareness in the next steps. So thank you very much.
Oh, sorry. I'm now unmuted. I was muted and unmuted. Thanks very much, Ima. That was a really lovely overview of some of the volunteering work that you've been doing in this space. So I'm Kathy Sade. I have the pleasure of facilitating a panel discussion now. So if the panel members just want to turn their cameras on and unmute themselves. So we are very lucky to be joined this afternoon by some great people who are willing to share their expertise. First of all, we've got Professor Michelle Kalasaya, who's from the University of Tasmania. We've got Roisin Sweeney, who is from Injury Matters in Western Australia. We have Carolyn Lowton, who is from Juntos Marketing. And we also have Kelly Williams, who's from Rotary South Pacific. So in the interest of time, we will just move on nice and quickly. And I might start, first of all, with you, Michelle, if that's okay. Can you maybe tell us a little bit about an example of a successful government engagement or policy change or communication campaign, maybe one that you've been involved in, but something that you think that we in the Alliance can learn from?
Yeah, thanks, Kathy, and thanks for having me. And it's amazing to see all the incredible work that you guys have done already. So I was involved in the launch of the National Parkinson's Action Plan last month. And so it's very similar, I guess, into what you're trying to do in that we really started, I think, back in June 2023. And, went and put in a submission to government for money to make this national action plan. And it's been really interesting to watch all the things that you're doing because very, very similar to what we did. So we started off with a task force that had a group of very collaborative and coordinated people who were leading academics, clinicians, people with Parkinson's, and representatives from state Parkinson's organisations that really came together to decide that we needed this national action plan. We went to Parliament twice. So the first time we went to Parliament, we really met with as many of the politicians that we could possibly meet with, as well as the Governor-General. And really tried to, I guess, understand from the government's point of view, whether they would want a national action plan. And I think one of the really good tips that they gave us was that they really wanted us to fit in with the chronic disease framework that they were about to re-release. And so they were kind of really encouraging us to align ourselves with that chronic disease framework that was going to be released. We had a very, I guess, coordinated approach in that each state went and approached different politicians with a plan of what we wanted to do. We really engaged with the Parliamentary Friends of Parkinson's, and then they actually hosted us up in Canberra for a national summit to end Parkinson's, where we did a very similar thing that you're planning in that we invited all the politicians along and they actually hosted it for us, and we had a number of speakers. We had a big media campaign around that time, and that included, kind of all in the national newspapers. We were on The Project on Channel 10. So there's lots and lots of communication and media at that stage. And yeah, we had about 100 politicians come along to that. It's one of those things where they're sitting in Parliament, so you've got all these bells ringing all the time, but they come in and out. And yeah, we were successful in May 2024, and getting that money to create the National Parkinson's Plan.
Fantastic, Michelle. It sounds like an incredible amount of work, but again, really lovely to hear all the work you've done, and it's great to hear some of the learnings that you've had, particularly around aligning yourself with the chronic disease model. That's fantastic. I might throw now to Aroa Sheens, because I can see you're unmuted. Do you maybe want to share with us some of your thoughts around either examples of successful government engagement or communication? Tell us what some of your experiences.
Yeah, of course, Kathy. I guess it does relate to what Michelle was touching base around government engagement, but it's a bit more broader than that. Over here in Western Australia, we've been really fortunate for the last 25 years to run the Stay on Your Feet program on behalf of our state health department here, and that's really focusing on reducing the risk of falls amongst older adults who live independently in the community. So for those of you who might not be aware on the Eastern Foreshore there, that it consists of a whole different range of activities, including direct community outreach activities, and also building the capacity of, as we touched on a few times already this afternoon, that broad range of health professionals that we're trying to influence to support older adults in reducing their risk of having a fall. And of course, we know there are a number of different factors that can contribute to older adults experiencing a fall, and therefore the rate of falls-related hospitalisations amongst the older adult population. And we want to continue to reduce that burden, of course, that falls has on the community. But we're really proud over here in WA that we have had the lowest rate of falls-related hospitalisation for a number of years now. Of course, we can't directly attribute that to our great work that we're doing here in the community awareness raising and education space. But we are proud of that sustained funding that has enabled us to deliver those variety of activities for older adults living in the community. And thankfully, we do have evidence as well to support some of the direct projects that we're delivering regarding peer education programs for older adult support and social groups out in the community. We also do community grant funding and also a whole range of different workforce development activities. But potentially of most envy to some other states is our statewide mass media campaign that we're able to roll out. And as Deb popped in the chat before, we still do have a long way to go, of course, in raising awareness of the preventability of falls, but the ability to have a mass media campaign to reach the mass of the population to hopefully over time continue to raise that awareness is really important in terms of that leverage that we can get within the community.
Thanks, Roisin. I know, yes, certainly the WA program is the envy of many of us over here on the eastern side of Australia. With the mass media campaign, like, you know, again, do you notice any uptick in engagement or activity from the community whenever those campaigns are launched?
Yeah, we definitely do. So we're in a campaign period at the moment. We run 3-month campaigns twice a year, and we can definitely see, I guess, the direct correlation in terms of our website traffic and people accessing that information, whether it's our online resources, our online directory to get that support. It's not just TV and social media campaigns, of course, that we roll out. We also have print ads in the media, and then people can call our inquiries line. So we have a ad going to print tomorrow, so we're anticipating that we know the phones are going to ring hot after that, people requesting that information. So yeah, we thankfully can see the reward that that does have in terms of people getting that education information to their doorstep.
That's really, really lovely to hear. I will now throw to you, Carolyn. So again, Carolyn's from Juntos Marketing. I hope I've said that correctly. So again, you obviously will come with a slightly different set of experiences. So we will be waiting with bated breath to hear for your wisdom.
Thanks, Kathy, and thanks for having me on the panel. It's great to be here and so exciting to see the progress that's happened even just in the last 6 months. I thought it might be helpful if I talked about one of the campaigns that we've run, so a communications campaign that was successful, and this was one around awareness and behaviour change. And it was for a government organisation. It was for South West Sydney Local Health District. It was a suicide prevention campaign, and that's the only thing I'm going to mention about the actual topic, because I know, that can be a difficult topic. But in terms of what the campaign was about, it was a new service that was a non-clinical alternative to going to the emergency department. And it's a terrific service, but no one was coming, and they didn't really understand why. And when we were first approached to pitch, they asked us, can you develop a whole lot of communications assets and collateral? And we basically had to say, no, we can't, because we don't really know what the problem is. And our approach is very much that you really need to understand the barriers and who you're trying to talk to and what you're trying to say before you start anything. So the work we did, and I suppose one of those kind of aha moments or the insights that we uncovered early on, was that there was a high awareness among mental health professionals, but very low awareness of the service among the wider health professional community and then among the wider community at large. So that then told us, I suppose, a direction that we needed to go in, and then we needed to work out how we would talk to those different groups. And we ended up doing what I'm sure many of you would know about, which was segmenting the market and looking at communicating in the right way to different groups. So communicating to health professionals is, we went a different route to communicating to people who have come from other sorts of community members who have come from other sorts of backgrounds. And we had a really strong input from the local community, and I'm happy to share the campaign afterwards if anyone's interested, but the local people were, and the users of the service were the heroes of the communication, so it was very authentic. And it really informed how we could have very clear messages and then a very strong professional design. And then the other thing that I always like to do is a pre and post campaign evaluation so that you can see what's working and what's not. And that's about long-term improvements and being efficient in the so that you can keep learning basically, because no one ever gets everything right at the very beginning. And the visits to the centre increased by 124% when we looked at the pre and post evaluation, and basically got to the point where this service was full, which is then the next stage is how do we help them extend and go the next step. So it's not a bad thing that it's full. It's just then you can take the next step. So I suppose that was my example.
That's a really fantastic example, Carolyn. I think some really strong messages there about, thinking carefully about who your audience is and who it is you're wanting to communicate with, and then really tailoring your communication strategies. And I also know in the chat here with someone commented that they were talking with their friends about the number of people that die each day for falls, and people couldn't actually believe that that was true. So again, I think that really, it really identifies one of the issues we do have in the falls prevention space. I will now throw to Kelly, Kelly Williams, who's from Rotary South Pacific, and as you all know, Rotary's really been a major force in the Falls Prevention Alliance and really representing the consumer voice. So I will throw to you, Kelly, for your thoughts on what we can do in space and also your experiences that you might have had.
Thanks, Kathy. And again, I want to congratulate everyone on the Alliance, and particularly the working group members who've just gone above and beyond to achieve what they have to date in the last 6 months. What a groundswell of work there is. At the risk of sounding like a broken record, I was also going to talk about a mass media campaign. I think we needed to diversify here, panel. But the example that I wanted to speak to was the Go for 2 and 5, mass media campaign, which aimed at raising awareness of fruit and vegetable consumption and how many serves people needed to eat per day. So this campaign was exceptionally well funded for 10 years, from 2005, up until 2015. And I guess I say that it was successful because there was a recall rate for messages of 70%. So that's outstanding, I guess, in public health circles for message recall. And not only that, of everybody that could recall the message, 30% of those had actually tried to implement that and actually eat more fruit and veg. So I think that's what we want to be doing here when we step into this space and start this work. I think not only is this example important in the sense that it was well funded and had national government support, but I think also it really harnessed the energy of the community and hyped onto other existing programs like Crunch and Sip, where children stop playing and have a bite to eat of a vegetable or fruit and a sip of water. And I think that's really important for us to look at what already exists in community and to really look at how we strengthen community action, because that's where people in their local areas have an opportunity to practice new behaviours that we ask them to do. So I guess in thinking that through about falls, what could that look like for strength and balance if we were to promote people getting enough physical activity, and particularly meeting those strength and balance suggestions from the new physical activity guidelines for older adults? What could that look like in the community sector? So I'm really looking forward to seeing how the Alliance harnesses the energy of all of the fantastic community organisations who've come on board to date. And just for Rotary's, to give Rotary a bit of a wrap, we have a fantastic track record of public health initiatives, and I'm thinking of the bowel screening initiative, which kicked off here, where we distributed as Rotarians kits to community, and then the government took that on. So we're really looking forward to helping in our corner as well. Thanks.
Thanks, Kelly. I mean, again, Rotary have really been an amazing force behind the Alliance, and I think it's a great way of making sure we keep community involved, and again, lots of things that we can work together there. That probably also leads really nicely into my, we are keeping an eye on the time, but probably one last question for all the panellists, and I'm going to go in reverse order this time so you can all prepare yourself. Kelly, based on what you've seen, the activities of the Alliance so far and what your thoughts, what do you think we should be prioritising as our next top priority over the next 6 months?
Ooh, I think building on what you've been working on is fantastic. I think there is an opportunity to look for funding and to look for that kind of executive support that would really help this work continue on a day-to-day basis and support it well. It would enable you to be a little bit more proactive, I guess, in terms of looking for those policy opportunities to have input there, as well as doing some of that mapping work as well, which I know was deemed as important as well. And I think that if it's not funded, it falls to us as Alliance volunteers, and that can mean that things move more slowly. I'd also just like to give a shout out to the Ottawa Charter in Health Promotion Circles, which is 40 years old. And it's really encouraging to see you focusing on healthy public policy and on helping people develop personal skills. But I think there are some other elements to that, like creating supportive environments that we could really tap into and look more closely at, and that's just my 2 cents worth. Thanks.
Thanks, Kelly. I'll throw to you now, Carolyn. So what do you think the Alliance should be focusing on over the next 6 months?
I love Kelly's, thank you. I think I liked all the feedback about the action plan, because I do think once you put everything together in an action plan, you can really see what needs to be prioritised. The other thing I think is everyone has a limited budget and limited time. So it's about where you're going to get the best bang for your buck and where you're going to get the best return on your time and investment, and who can help you to get to the next stage. So whether that's particular politicians that are going to champion it, whether it's someone within whether it's federal or state departments, someone, and they might champion it for a whole lot of reasons. It might be because of their personal experience. It might be because it's part of their KPIs, their performance indicators, and this just happens to resonate with what they need to achieve for the year. It might be for politicians what their constituents are after, but trying to find those allies who can really help the push help share the burden of the push and help really gain traction.
Yeah, fantastic. Thank you. Roisin, I'll throw to you now.
Thanks, Kathy. I guess one thing that hopefully has become evident over the last hour is the amazing work the Alliance has already done in the first 6 months since we launched, but the value behind that is really what's come from connecting a really passionate group of people together towards a common goal. So if we're able to leverage that more by truly understanding what effective interventions are happening on a state-based level, so we can explore the transferability of some of these initiatives across other states and territories, because we know there's great things happening across the country, but if we can make that accessible for everybody across the country, I think that would come a long way in terms of policymakers and health professionals and community members alike, or recognising that the priority public health issue that falls prevention is at the moment.
Thanks, Roisin. And last but not least, Michelle, what do you think that we should be focusing on over the next 6 months or so?
Thanks, Kathy. No, I think you've voted that the National Action Plan is a priority, and I think getting in the ear of the National Minister for Health or her advisors, I think, are really important. And I think the other thing is that you're showing, you've got a big groundswell, so I think that's super important to show the politicians as well. And then I think the final thing is it's not just the action plan, it's also the implementation plan. And so having a bit of a look at particularly the Dementia Action Plan, they also have who will implement each part of that plan. And so I think, sometimes it can just stop at the action plan, but you want to then obviously be thinking immediately, or if not before, about implementation.
Thanks, Michelle. Really, really fantastic words of advice from everyone on the panel. So I will thank you all for sharing your expertise with us. And in the interest of time, we have got 4 minutes left. I will hand over to Frances, who is going to close us off for today.
Thank you so much, Kathy, and thanks everyone for attending. I'd like to just take a few minutes to reflect on what the first 6 months of the Alliance has represented and why our work matters. So obviously when we were established, it was built around a shared recognition that falls are one of the most common, costly and preventable causes of injury, but they're not inevitable. But unfortunately, this is not, as we've already seen today, this is not really well known. So what we've achieved together in the last 6 months, you've heard of all the activities, and it's been an incredible body of work, is that we've created a national platform that brings together health professionals from right across the different sectors. And importantly, the voice of consumers is very much front and centre around that connection and that network. We've broken down silos, so often we work at state-based level or in different organisations across different sectors, working on a problem, but we've joined people together. And everyone who is here at this session is also a part of that. And we've elevated falls prevention, I think, from just being an issue that people sort of talk about to actually having this shared strategic priority. So we've really worked on having a common language and really that strategic intent to make a difference. And I think what we've heard that's vital is that we really do need a national action plan, and alongside with that, so thanks Michelle for that, an implementation plan to go with it. So why the next 6 months, I think, matter even more. Even though we've made a lot of progress, we still need to do more. We need to strengthen our shared priorities and the focus areas, and some of that can come out of that mapping exercise and your feedback. We do need to look at funding, not just for the action plan, but for the work that goes behind that. We need to support consistent messaging around what works in falls prevention and really make that readily accessible across the broader community. And we need to continue, I think, to amplify the voices of lived experience, because those stories really matter and can really make a difference. And I think we need to continue to advocate for falls prevention as a core public health priority, and that will be seen with our National Action Plan. So, in closing, I would really like to thank all the presenters and the panelists for your excellent presentations. I'd like to acknowledge and thank all those who have contributed their time, expertise and energy in these early months of the Alliance, and particularly to those who are champions at their own organisations, thank you so much as well. And to everyone who has joined today, your presence reinforces that our work matters. So I think I will close there, and obviously we have a lot of resources to share. We want to keep you informed, so be on the lookout for newsletters and other links. Access our social media, share widely and share often, and let's keep the conversation going to keep working together to reduce falls and improve lives. So thank you very much. We will conclude the webinar now.